Hello everyone. Let's learn how to manage this patient who's come to the ER and the X-ray looks like this. Now what you're seeing here is free air under the diaphragm. So this is suggestive of a hollow viscous organ perforation, and the most common cause for this is a perforated duodenal ulcer. Now what is the most common cause for a perforated duodenal ulcer? That is a peptic ulcer disease. Now just digressing a little bit. If they ask you which is the most common complication of a peptic ulcer disease, then the answer is going to be bleeding. Okay, so the posterior ulcers bleed and the anterior ulcers perforate, and this is how the X-ray is going to look. Now, the initial and the first modality of treatment is to resuscitate the patient with IV fluids and IV antibiotics, and only then you're going to take them up for surgery, either in the form of laparoscopy or laparotomy. Now this is how it looked like when we did the laparoscopy. You can see the perforation and bile coming out of the perforation. Now coming to closure of the perforation, that depends on the size. If it's less than 1 centimeter, primary closure can be done. If it's 1 to 3 centimeters, you're going to go ahead and do a modified Graham's omental patch repair. And if it's more than 3 centimeters, you can either do a pyloric exclusion or a duodenostomy with the help of a 3-tube technique. Now, please remember, at the end of the day, the causative organism for all these conditions is H. pylori. So, once the patient recovers following surgery, please make sure you treat them with the anti-H. pylori regimen. Thank you.